Hello, everybody. This is our ethical dilemma presentation featuring Ariana Hardney, Macy Smelzer, and Kiani Strickland. The ADHA Code of Ethics is where we'll start. This helps the dental hygienist develop strong clinical awareness. It's established nationwide as our standard of ethical principles, and it helps the dental hygienist maintain a unified approach to patient care. It also helps with fostering trust, professionalism, and integrity. If you were wondering what an ethical dilemma is, I'm going to tell you. It's a situation in which a choice has to be made between two courses of action. It either entails transgression or a moral principle.
Okay, this is Macy talking now, and ethical dilemmas in dentistry, there are multiple examples of these. Some examples we have listed are informed consent, breaches of confidentiality, patient autonomy, over-treatment or under-treatment of a patient, language or financial barriers, dishonest colleagues, and patient non-compliance. And it is our responsibility to uphold ethical standards while prioritizing patients' health, safety, and well-being. Every decision we make has the potential to impact patients' overall health, which is why applying and understanding ethical principles is crucial to make the right decision when faced with an ethical dilemma. So, for our ethical scenario, we decided to go with a patient who is 17 years old and she is pregnant. This patient comes to the dental clinic because her tooth number 19 is very painful. And after a dental examination and our examination, it's determined that it is severely decayed and she needs restorative treatment as soon as possible. Her mother joins her to this appointment because she is a minor and the mother will be paying for the appointment. So the dilemma that we face is the patient needs treatment, but she's in her first trimester of pregnancy, and she requests that the dental team does not tell her mother about her pregnancy because she has not told the mother and she does not want her mother to find out. So when analyzing this ethical dilemma, some concerns and principles that we are faced with are patient autonomy, which is defined as people having the right to respect, informed consent, and the right to a full disclosure of all relevant information in order to make informed decisions about their care. Confidentiality is the respect for a patient and their information as a demonstration of our respect for patient autonomy. We are also faced with concerns of trust and respect. We need to consider the rights and respect the patient has for us as professionals while also considering the rights and respect that we have of the patient. Aside from that, we also need to consider the legalities of the legal guardian, which is her mother, since the patient is a minor and the mother is paying for her treatment.
Okay, hi, this is Kiani speaking. On this side, we'll be talking about application of the ADHA Code of Ethics. So first, we would explain the risk and benefits to the patient and the concern of providing treatment in early pregnancy. Then there would be a discussion about how patient history or treatment is not to be shared with family or friends or spouses. So, that would reassure her of that confidentiality. And then the best choice of action is to first listen to the patient's concerns, counsel them, provide all relevant information, and suggest they talk to their legal guardian about their pregnancy. Some legal considerations. The patient is protected under HIPAA even though she is 17 and the patient privacy laws. The clinician cannot disclose the patient's pregnancy to the mother without the patient's consent. Minimal amount of patient information to be disclosed for payment reasons to the mother so the mother can understand why the patient won't be receiving treatment that day, but you can't fully disclose that the patient is pregnant. So, for example, you could say to the mother, for patient safety, we sometimes need to delay certain treatments based on medical considerations. At this time, we are unable to proceed with x-rays and the filling today, but we can reevaluate treatment options at a later date. So, in conclusion, follow the 7 core values of the ADHA Code of Ethics. These guide professional behavior and decision-making. Ethical dilemmas are inevitable, but by implementing these values and staying true to your morals, it'll help you make the right choice.